Hi everyone, I'm Ibrahim. I work as a doctor in the NHS. Today in this video, we're starting out a new series called Your Specialty of Interest. In these videos, we're going to discuss about a specific specialty and go on towards to find out how an international medical graduate can progress and work in that specialty.
If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe.
Our today's specialty is Acute Internal Medicine. Let's get started. So acute internal medicine is the truest sense of internal medicine that you see unselected patients of different presentation. This is the first door of medicine in NHS hospitals. So what is acute internal medicine? So it's a definition from Joint Royal College's Physicianly Training Board. So it's like the first step of getting into medical care in a secondary care that is in a hospital setting. So the patients who get referred from emergency medicine as a medical patient, like they can be problem with the respiratory, gastro, neuro or anything, they first gets to the point where acute internal medicine takes care of them first. And if they can solve the issue, they can solve the issue. If they can't, then they refer it to the subsequent specialties. So basically, it's the first step of internal medicine in secondary care hospitals. Let's see how the specialty training pathway is laid out for acute internal medicine training. As you can see, this is a bare bone structure of any specialty training in the UK, which is uncoupled. Uncoupled means the core training is separated from the specialty training. As you can see, you have to get a foundation training done, then core training and specialty training done. But for an IMG, the things are a bit different because there is an element where your foundation training, half of it can be accepted by your internship done back home, or you may have worked in your own country and you can sign an alternative form to prove your competencies, which is equivalent to the UK training. So for an IMG, GMC registration first, and if you don't want to do foundation training, you can get it equivalency, which is called CREST. Elaboration would be Certificate of Readiness to Enter Specialty Training. And if you don't want to do core training, or you have done some equivalent work which you can prove with an alternative core competency form. But alternative core competency form or a core training along with MRCP is absolutely necessary to join specialty training in acute internal medicine. And whether to do foundation training or to take another route, I don't want to elaborate more in this video. Dr. Ibrahim have done a fantastic video explaining what happens after you get the GMC registration, which is the best way for an IMG to start with, whether it's a non-training job or a FY2 standalone or a foundation training from the get-go, which is UKFP foundation training. So the thing is, whichever you take, all leads down to one point, which makes you eligible to apply for a core training module. So what is the core training module for acute internal medicine? Core training module for acute internal medicine, there are two, so you can take either of them. So what happens if you take internal medicine training, that gives you a window to join a lot other medicine specialties, whereas there is another core training module, which is called Acute Care Common STEM, like everybody calls it, ACCS in the short form. ACCS have three separate specialties, which they're very streamlined to work in. So acute medicine is one of them. Another one is emergency medicine. Another one is anesthetics. So if you take ACCS anesthetics, you'll be working in anesthetics, emergency medicine, acute medicine, but your goal is streamlined to join anesthetic training. So you have to take ACCS AM to join acute internal medicine training if you want to take that path. Otherwise, if you take IMT as a core training module, like after getting CREST form or finishing foundation training, whichever you did, if you want to join internal medicine training, a lot other medical specialties are open for you, like acute medicine, cardiology. I mean, ACCS have other specialties equivalency as well, but if you really know that your specialty, which is uncoupled, you have to know which core training module are accepted to join in that higher specialty training. So in between this training, when you join internal medicine training in acute care common stem, if you want to join internal medicine, acute internal medicine in the later on, you have to finish some exams, which is MRCP, and other things like WPBA is called workplace-based assessment. So in between the training, there is exam as a part of the training. You have to pass the exams of MRCP Part 1, Part 2, and PACES. At the same time, there are assessments that are done every year. So they have a target of doing different assessment to prove your competencies, and you get an annual review of your competence progression, your ARCP. So every year you get an ARCP done as a trainee, and that progresses that you are achieving the competence of the training to join a higher training later on. And as I mentioned earlier, if you have worked in similar training environment somewhere else outside the UK, there is an alternative core competency form that you can fill out by your consultant. So you have to download that alternative core competency form from I think ST3 recruitment website. And if you look at the form, you'll know what are the things they're looking for. What are the things that a consultant have to sign you off. If you have done all those things in your training back home or in a non-UK country, you can get this alternative core competencies form signed off, which makes you eligible to apply higher specialty training without going through any of these core training modules. So all these three items is actually giving you the competencies of starting a higher specialty training in acute internal medicine. So the specialty training for AIM, let's just break it down a bit more. So you have finished any core level training, which could be IMT, which could be SCCS AM, or you have signed off an alternative core competency form from your consultant and completed MRCP UK full parts like Part 1, Part 2, and PACES, and then you apply for it, this specialty training, get an interview, and then you join 4 years of specialty training in acute internal medicine. It starts from ST4 because you've done 3 years of IMT or 3 years of SCCS AM. There is no ST1 acute internal medicine because it's an uncoupled specialty. They didn't start at ST1. They will start at ST4 because you have to get those other 3 years preceding that in some core training module form. And in between this training, you have to attain a specialist skill. So we'll discuss about it a bit later in more detail, what kind of specialist skill. But this is a part of acute internal medicine training in the UK, that you have to have a specialist skill obtained before you obtain a CCT. CCT, which is called a Certificate of Completion of Training. And you see SCE, here again, there is a specialty certificate examination. You have to pass on acute internal medicine, and you have to get through workplace-based assessments, like as I said before, for IMT and SCCS AM. In specialty training, higher specialty training, you have to have those as well. And by those done, you actually get assessed for your competencies that every year has. And then finally, you get CCT, which is called Certificate of Completion of Training. So this is the list of specialist skill that you can obtain as an acute internal medicine registrar, and then you can make your work profile as a consultant as well. So procedural skill, it could be additional qualification. In a procedural skill, you can see you can pick up echocardiography as your specialist skill. So you'll be an acute internal medicine specialist. At the same time, you can do echocardiography. You can have a list in your hospital that you'll do general echo, like outpatient echo or something of that sort. Same goes for endoscopy, bronchoscopy, and ultrasonography. Additional qualification, you can get any diploma or any masters in any of this and get equivalent role in this in your consultant job. And other specialist skill is like special interest. So special interest is intensive care and stroke medicine. So you can actually get dual CCT if you take further training. So after finishing 4 years of internal medicine, as acute internal medicine training, you can actually join further year of intensive care medicine training or a further year of stroke medicine to get those under your belt as a specialty interest. Also being a specialist in those specialties as well. As you can see, if you want to take a research as your specialist skill, you have to at least have 5 research publication and peer-reviewed journals during your acute internal medicine training. So how competitive is acute internal medicine? We get asked this question a lot, and I think we want to emphasize that when you apply for ST3 application, you don't apply for only one. Like after you achieve that competency, you can apply in any ST31. But obviously, your portfolio and your application and everything is made for only like a few of the specialties. Like, if you are focused to join cardiology, obviously you have done cardiology related research or publications or audit, you have done those related training courses, teaching sessions and all the other stuff. So that application does not hold that much water if you want to apply in gastroenterology, does it? So, but you can. I mean, it's not saying that you can't, but you can apply in all the specialties as ST3 level. Like you can apply in acute medicine, gastro, cardio, neuro, whichever you want ST3 post, you can apply. But at the same time, you have already prepared in your core training module which way you want to go. So you have that specialty ready. So how the competition ratio can be deceiving is applications sometimes that, people probably are just applying for acute medicine just to see if they can get an interview in this, but their portfolio is targeted towards cardiology. So even if they get acute medicine, but if they get cardiology, they will not take it. That means they made the application, but they're not actually wanting it. So it's the number of application versus the post. So let's see, in 2018, the number of applications for acute internal medicine was 257 against 131 posts. That made a competition ratio of 1.196. That means for one post, there was 1.96 person competing. In 2019, 322 people applied. Mind you, these 322 people might not have in heart that they really want to join acute internal medicine, because you can apply in multiple, as I said earlier. Post available was 110 and competition ratio rose to 2.93. In 2020, I think a lot of specialties recruited less number of trainees due to reduced provision or something of that sort. But a lot of applicants applied for acute internal medicine in 2020, but only posts were available 94. That is a huge competition ratio of 5.43. So for one post, 5.5 people actually competed. So you can see the trend. If you look at the trend, obviously the trend of competition is going higher. So you have to have a competitive edge in your portfolio and your application before you want to join acute internal medicine specialty training. This is also a common question. What is the pay of acute internal medicine training and specialist? We also get another very interesting question. How much will it cost to get trained in this specialty? We try to debunk this a lot in many of the videos and articles and in social media. You don't have to pay to get trained. Rather, you get paid as a trainee because you're providing service. You are also getting trained as a part of the whole process. So you are getting paid for the training you're receiving because you are a trainee and you are also working in the hospital. So it's a national thing. So, and also the pay scale is not specialty specific. The pay scale is your level of what you're working at. So it doesn't matter whether you're working in acute internal medicine or cardiology or gastroenterology. If you're an ST3 or ST4 or whichever stage you are in, you're getting the same pay. This pay that I'm showing here would be the basic pay. There will be enhancement on top of it based on the rota and how frequently you will do on-calls and stuff. So if you're in a very busy hospital where you do frequent on-calls, your pay will be higher than a bigger hospital when you do less on-calls because they have more staff. And this is only for England. For ST3 to ST5, you make a basic pay of £50,017 a year. And for ST3 up to ST8, you get £53,077 a year. So as you can see, an acute internal medicine start for ST4. So for the first 2 years, you get the 50,000 one, and the next 2 years, you get the 53,000 one. And for consultant, the starting pay of any medical specialty, I think sort of any specialty, is 82,096, and it grows up as you gain more experience and get awards or assume more responsibilities of that sort. If you want to know a bit detail about how you can break it down to find out what will be my take-home pay, how much per month I'll be earning, you can check out this video by me about a doctor's pay in the UK, where I've given you the more elaborate explanation of how doctors' pay in the UK work. So let's summarize the whole training pathway a bit for IMG specifically. So obviously you become a medical graduate first, and then you get full GMCQ registration. Now you can get provisional GMCQ registration and join foundation training. So your pathway will be exactly similar to the shown that way before. But if you've already done internship and you obtained full GMC registration, then this it will resonate more with you, I guess. Yeah. So non-training job. Non-training job, I have used this title to elaborate all the job that you can get in NHS jobs. The title would be Trust Grade, Clinical Fellow, SHO, FY2, LAS, those kind of all amalgamate into non-training job, which are there to service provide. But taking this job actually gives you the opportunity to first settle down in the whole new healthcare system, and secondly, to achieve those portfolio points that you need to apply for training. So for IMT training application or SCCS application, you have to compete with other people. But if you have not done many things back at home, or if you have not done like things that are available to be done by the UK graduates, because you'll be competing against UK graduates as well. So you have to have that time in the NHS and understanding the system and gaining those items for your portfolio, like having a clinical audit done, having a presentation, maybe a publication or a teaching session, or all those things, or a leadership role. All those things play a role in managing your portfolio. And at the same time, to apply for a core training module, you need a CREST, as I mentioned before. And with a non-training job, you can get the CREST signed by speaking with a consultant that you'll be working under. So how long will you have to do this non-training job? This is completely up to you. So I would definitely say if you are a new graduate, at least a year of a non-training job would set you off for a further core training in the UK. But say now for a non-training job, it goes, you can join an IMT or SCCS AM, and after passing MRCP in IMT SCCS AM, you can start an acute specialty training. So there are two competitive processes here, because to join IMT there is recruitment, and to join AIM specialty training you have to go through recruitment as well. Now you can take a bit separate pathway, because if you have GMC registration through MRCP, what can you do? So if you have GMC registration through MRCP, you have completed MRCP already, all the parts of PACES, and you've got GMC registration, you can actually start a non-training job in a bit higher, like as a registrar or something, or you can move up to, like say, you can work for 6 months as an SHO, you have understood everything, and then work as a non-training SPR or registrar post, and your target in that registrar post will be to gain all the things that is mentioned in alternative core competency form. So if you can sign that form from a consultant, you can actually think of then applying for an acute specialty training in a higher specialty training. Or if you choose no, I don't want to jump into higher specialty training, I want to go through the whole process of internal medicine training as well, because I'm not sure whether I want to do acute medicine straight away, you can do that as well. So if you have alternate competencies signed, that actually gives you, like you don't have to sign CREST form for that. You can directly join AIM specialty training. But if you want to join IMT, you have to get the CREST form signed for whichever job you're doing right now. So this is in a nutshell everything. If you're still confused about what a training and a non-training job is, you can watch this video as a part of the course that we did applying for NHS jobs, which will be linked in the description, which elaborates more about the difference in applying for the training and a non-training job. There we go. We have discussed the specialty training pathway of acute internal medicine. If you have any questions, feel free to ask in the comments below. We'll be happy to answer. Thank you for watching. We'll soon be coming out with other specialties in this way, discussing the entire pathway and career progression in those specialties. Please don't forget to subscribe and turn the notification bell so that whenever we come out with a new video, you get notified. Like us on Facebook, follow up on Twitter and Instagram, and have a nice day. Thank you.